So today we are very excited to welcome Jazmin Long, President and Chief Executive Officer of Birthing Beautiful Communities, which is a community of birth workers, or doulas, who provide social support to pregnant women at highest risk for infant mortality, in addition to a holistic set of services which give women from historically economically depressed neighborhoods opportunities to increase their personal and family wealth. Jazmin is a Cleveland transplant with a background in community development, fundraising, perinatal support, economic, and workforce development. She joined Birthing Beautiful Communities in the roles of Vice President of Fund Development and then Chief Operating and Development Officer, and then was named CEO in April of 2021. She is a dedicated community leader, serving as the board chair of the Near West Theater and serves on the board of First Year Cleveland. She is a graduate of the Mandel School of Applied Social Sciences at Case, holds dual master's degree in social administration and nonprofit management. She is also a graduate of Connecticut College, as well as a graduate of our Campus Cleveland and Advanced Leadership Institute programs. Please welcome Jazmin.
Thank you. Good afternoon, everyone. It is really my honor to be here with you all today, and I see so many faces that I recognize, so good afternoon. Good afternoon. I'm excited to be here with you all today, and I want to talk a little bit about Birthing Beautiful Communities. I know that we've done other conversations around infant mortality, so we know that we have a crisis in our community, but I want to talk about what we do at Birthing Beautiful Communities, which is that we connect the dots of life. Our agency is a network of perinatal support doulas. A doula is a trained birth coach. Our goal is to be there with moms from anywhere from 12 weeks pregnant till their baby's a year old. We attend their labor delivery and provide the social support that they need in order to have the birth of their choice. So our mission, our organization was started in 2017. The mission is to address and improve the community and systemic structures that lead to poor birth outcomes through culture, education, advocacy, support, and engagement. So our organization is a network of 43 African-American women and one man who leads our fatherhood program, who is serving about 500 clients in Cuyahoga and Summit County, trying to reduce poor birth outcomes in our community. So what is our difference? I am a traditionally trained doula before coming to Birthing Beautiful. And so I went through a 3-day training, I attended some births, and then I was sent out in the world to be a doula. Well, our program is supremely different because we are providing about 80 hours of training that can go anywhere from 1 to 2 weeks. We're going through vital signs training. We're giving them CPR training for infants and adults. And so we're really ensuring that they have a full understanding of how to work with patients. One of the things that we saw during COVID for our clients a lot was that we needed to get some chronic disease management training for our doulas because we were seeing high blood pressure, hypertension, and diabetes amongst the women that we were serving. And so we wanted to be kind of a little one-stop shop if they needed some support around that. So with funding from Cleveland State University, we were able to get our doulas trained with chronic disease management as well, so that they can really serve our clients the best way. We have a network of 6 certified lactation counselors, myself included. I am a certified lactation counselor, so that we can offer breastfeeding support. Nationally, the breastfeeding initiation rate for African-American women is 54%. Our breastfeeding remains in the high 80s, so between 85 and 88% of breastfeeding initiation rate, and we serve about a 99% African-American clientele base. So if that gives you any indication of what we're doing with our mothers over here. We have a dedicated teens program where we're serving, if we get a teen student that comes to us, we stay with them, and not until their baby's a year old, but we stay with them until their time they graduate high school. So we want to ensure that they don't have any barriers because they had a child to completing their education. Our teen program is led by someone who does this in her daily life as well, and she's a doula as well, so that's really great for us. We're helping them with the self-sufficiency and goal planning. We provide sexual health and reproductive education. We are continuously working with them around classes. We host about 3 classes a week, and that's kind of one of the good positives for us at COVID. Let's say before COVID, we would have anywhere from 20 individuals attending classes, but going virtual, we have between 40 to 50 and sometimes 60 individuals now attending classes. So even when we decide to go back in person, we'll always now go to some kind of hybrid model because we see that there's a major need. We have breastfeeding support groups. We have so many different support groups so that there's different needs because, again, we're serving all women. And I kind of want to be clear about this, is that often we think about infant mortality and we think about a person that may be low income. However, we know that infant mortality impacts African-American women across the spectrum. It doesn't matter their socioeconomic status. It doesn't matter your education. So we're really working with diverse groups of women and making sure that we're meeting every single person where they are. So what do we do? Our services are very holistic, very wraparound. We have OWN, which is our mental health and support services. We offer grief recovery therapy for women. We have a network of Black therapists because we know that toxic stress is the leading cause of extreme prematurity. Extreme prematurity is the leading cause of infant mortality. And so we want to teach our moms how to address anxiety, panic, depression, fear, nutrition and wellness. So we're working with them. We have a certified nutritionist who is a doula who works for us, who's working with our moms around healthy eating and education around that. We work with Burton Bell Carr sometimes to use their test kitchen. And so we will like to start going back in person, but again, some kind of hybrid model. Because I often say to people, let's say you go to the food bank and they give you a piece of zucchini and you've never cooked a zucchini before, you don't know how to cook it. So what do you do with it? It goes to waste. And so we want to ensure that any produce or products that moms are getting, that they actually know how to healthily prepare it and have some use for it. So of course, the childbirth education classes and workshops, our teen programs, so we want to help them transition into their new role as a parent, but ensure that they can still finish school. Labor support. Sometimes we labor a little bit with moms at home before we transition them to the hospitals. We work with every single hospital systems between Cuyahoga and Summit County. We do births at everyone. Transportation. So we know that it can be really challenging for moms to get around. So we provide transportation to grocery stores and every doctor's appointment that they need assistance getting to if a doula is not taking them. Breastfeeding and lactation services. And then of course, postpartum support, which is including overnight care, which is something that we stopped doing during COVID, but we want to start doing again, which is where we will go to someone's home and help them, with their baby overnight so that they can actually get some rest. And if they have twins, we've been able to help them get the babies on a sleep cycle so that they can really alleviate those stressors from them. So our approach is very simple. We're educating clients, we're creating a birth plan for them, we're attending appointments, we're reviewing what the clinician said to them to make sure that they understand. Pregnancy is a very vulnerable time, and it doesn't matter who you are. Sometimes you just get afraid to ask doctors questions. So we're asking them before those appointments, write your questions down. Don't wait till the last minute to ask them. You at least ask 3 questions every time that you go to the hospital so that you make sure that you're understanding and that you're not just listening, that you're really understanding what the doctor is saying to you. So we try to create a connection between the community, the family, and clinicians. We reinforce evidence-based information. We try to model behavior and we try to set realistic goals. So we try to operate ourselves as a staff with respect and dignity. And that should pour into how we treat our doulas with respect and dignity. And that should pour into how they treat the clients we serve with respect and dignity. And we want to ensure that we are able to have a dignity-filled birth. So our maternal mortality project, we have a partnership with Moms First, Metro Health, where we are able to go into the jail system, the Cuyahoga County Jail, and provide services to women who are incarcerated. And we are also attending their labor and delivery. They are not shackling these women. They are having private labor without guards. It's just our doula, the nurses, and the doctors, and they're having dignity in their pregnancy and childbirth. So no matter what they've done to be where they are, they deserve to have a healthy birth, a safe birth, a birth filled with dignity for them and their babies. We can, once we are in the jail, we support them with breastfeeding support services. We have classes for them. We have books for them. We ensure that they're getting the water that they need, that they have the fresh produce that they need. And so this is one of the only programs like this in the country. And we will now be going to Marysville prison as well with someone who's been transferred over. And so this is very exciting for us because again, we just want to make sure that they're able to have safe and healthy births and that everyone has a good experience. Our wellness network, our wellness network grew out of First Year Cleveland, and it is under the direction of my colleague Tammy Jones, and we are offering counseling, grief recovery, peer support, and really making sure that whether it's addiction, whether it's the loss of a child, loss of a spouse, loss of a brother, something that we're making sure that the women that we're serving have the emotional and behavioral support that they need to really push past and get through their lives. And I should note that all of these pictures you see, these beautiful pictures are our actual clients. We took these photos and these are the women that we're serving and the families. So training. Our training, as I shared before, is incredibly intensive. We have 10 modules of training. It's 80 hours. They must pass with 80% or higher. 10 of our team members have been trained as community health workers. That's that advanced training piece that really is centered on chronic disease management. We're having weekly staff meetings with them. We do monthly professional development. They've gone through environmental health watch training. We've done AIDS and HIV training, sex ed training. We're about to have LGBTQI training next week so that we're able to really help anyone that comes into our organization, and we're able to do so with respect. Our training includes case reviews, homework assignments, project reports, and community engagement. And thanks to Cleveland State University, we will now be able to have access to a pregnancy simulator, which means that we have a mannequin that actually goes through the labor delivery process. There's crash cards, so that the doulas that we're training new to come in have the ability to really see what they're going to experience when they go into that hospital room. It is my goal that we will be so well trained, so well respected, that the doctors and nurses that we work with they do recognize that we are leaders in this space. And so it is so important to me that we're training, and we're training well, and that my colleagues really know what they're doing when they go to those hospital systems. And so where are we today in closing? We've served over 1,000 clients. And when you recognize the infant mortality and maternal morbidity crisis, we have served, again, over 1,000 clients. We have not lost a single mom in our program. And our infant mortality rate is 99.8%, which is from our evaluator at Cleveland State University. So we have incredible statistics, and we know what works. Our doulas are incredible women who are with care, dignity, and love serving the clients in our program. We take a holistic approach, and we have to do not a one size fits all, because we have to tailor each and every interaction that we have with our doulas and our clients to said client. And so that's why it's important for us to get to know each other, know who can handle what. Our training is continuous. We're always having meetings. We're always having touch bases. We're always looking at the data. We're always growing our partnerships. We're always trying to strengthen our relationships with the hospital systems, because it doesn't work alone. It works as a community. And so I think that's it. And that is Birthing Beautiful Communities in a nutshell. I'm going to stop my share. And I hope I didn't go too long, Rachel.
Oh, Jazmin, you were great. I think you covered such an array of phenomenal programs. And there's some great interest to learn a little more. So first, are all of these services complimentary?
Yes, we provide 100% of our services free of charge. Honestly, this is something that we sometimes go back and forth about, but this is why I love having diversity of thought, because I'm not a mother and I do pretty well for myself. And so we started to say, like, we can charge people on a sliding scale. Why can't people pay for the services? And then one of my colleagues, who was a mother of 2, young, does well for herself, she and her husband, pushed back. And she said, Jazmin, we might be doing well on the outside, but we still have student loan debt. She told me that childcare is $2,500 a month for her 2 children. And I was so blown away by that. And so I will continue to think about, what do we do in terms of sustainability? I didn't put this in the presentation, but we do a lot of advocacy work. So we're fighting right now for House Bill 142 and House Bill 611, which will make doula reimbursement possible. Right now, doulas do not have a code to bill for reimbursement. So we have to do this work, relying really right now a lot on government and philanthropy and individual giving. So that's been challenging, but we also, with the birth center that we're building, we're going to be able to bill for reimbursement there. So that's incredible. We'll be able to bill for doulas in the birth center, because it will then be kind of like a medical model.
Can you share more about your program evaluation and assessment of success?
Absolutely. So we have been working with the same 2 researchers at Cleveland State University for about 6 or 7 years. I understand the importance of evaluation research to prove the efficacy of our work. And because of how we're doing this work, you really want to make sure people have the right data. So we've been working with our researcher, Dr. Heather Rice. She comes to every single staff meeting with us. She just came to our staff retreat with us. She's intricately engaged in helping us. We're working on a new assessment tool, a universal risk assessment that we would like to pilot with the 3 Black-led nonprofits doing this work, so that we can look at if we can really have one evaluative tool that can work across the county to be able to prove how the intake process works, if that makes sense. So we're working very closely with CSU. We received 2 $1 million grants with CSU for a 3-year work around creating an app called Thrive. And we are really looking at taking this to the next level. So evaluation is a very, very, very important part of our work.
And do you have any multilingual doulas?
We do not. And in the cases where we have gotten individuals who speak language, like we have gotten in Akron particularly, we get a lot of international clients. And so we do work with organizations like us together to provide translation services.
So a couple of questions have come in to ask about, where are your support sources, funding, and what does that piece of your organization look like?
Absolutely. So right now we have about a $2.6 million operating budget. And I would say a good 70% of our funding is coming from the state, whether it's the Ohio Department of Health, whether it's the Ohio Department of Medicaid. We get funding from the Ohio Commission on Minority Health. mental health and addiction services, and we also receive funding from Governor Mike DeWine through executive order, about $1.4 million over 2 years. So a lot of that is how we're getting our funding. We get a large support from the Cleveland Community Foundations, and we just hired a new person for development. I've been on one-person development team for the last 3 years. So we just hired one person to help with development so we can grow our individual giving, we can grow major gives. Of course, we're working on a capital campaign for the birth center, but it's really been me doing a lot of work. And so now I've joked and I said, I've never worked for a nonprofit that had more than one person in development, and we're about to have 3 people working in development. That just gives you a sense of the community's trust and faith in us in order to get our work done.
So looking to the doulas, first part of the question is the doula training fee-based, or is that complimentary like the services you provide? And what are your doulas paid and what kind of benefits do they get?
Absolutely. So that's a really good question. Our training is actually a paid training. They must pay to go through the training. And a part of that is, one, we want to get the buy-in from them. The training takes us a lot of time to do, and we want to ensure, and that is a sustainability piece. That is a funding piece of income for us. And so we have doulas who choose to work for us, and we have doulas who don't work for us, which is how we've trained over 150 doulas. We have women who are just in the community who wanted to be doulas, so they train through BBC. We pay them right now $20 an hour. Some of them are making 24 or 25, depending on the number of years if they've been with us. And we pay between $500 and $800 for birth bonuses. During COVID, we were paying everybody an $800 hazard fee for anyone who was willing to go to the hospital. Now that things are back to normal, we put that back to $500. And then we're offering them a ton of professional development. We're paying for them to go to conferences. In September, our entire team is going on a trip to Mexico. You know, like, we try to do things that really take the stress off of them. I have a coworker who's been here for 7 years and never taken a day off. We just offered her a month off paid so that she can have some relaxation. She would not stop doing birth unless we literally would force her. And that's how much the women who work here care about this work. But we want to make sure that we're having them to have self-care, because if we can't tell our clients to take care of themselves, if we're not taking care of ourselves and each other.
So you mentioned your capital campaign, and what is the financial goal of that campaign?
You know, it changes every day because my vision grows larger and larger. But what I will say is that right now, on Monday, we will be acquiring the property on East 66 in Chester, and we'll get a firm understanding of what it's going to cost us to tear this building down. But we have been pursuing $8 million is our goal. We have a $2 million request into the state capital budget. So if anyone knows Senator Dolan, feel free to make a call. We feel very hopeful. The Ohio Addiction and Mental Health Services has already agreed to be our fiscal agent, which is tremendously huge, because again, it just shows that we are very well respected at the state level. And we have 2 lobbyists working for us, so we don't do this work alone. We've understood that we have to get doula reimbursement passed. We have to really stay on our legislators to ensure that we can do this work for years to come.
And thinking around the advocacy work that you do, reproductive rights and what might be coming around Roe versus Wade has been such a huge topic of conversation lately. How do you see that impacting your work, a role for your advocacy?
So I truly appreciate folks making the connection between what's happening with the Supreme Court and our work, because what I see is more moms who are going to be in need, more moms who are going to need potential mental health support, more moms who are going to need our full wraparound support services to be there for their children, and more doulas needed to assist with the number of births that are going to happen because of what could potentially happen. So I see that, I really think about how it could impact our work tremendously. More moms and babies are going to not make it because of this.
Can you talk about your referral process?
Yes, so we have multiple ways that we can be referred to clients. We can, on our website, we have a referrals tab. We have a referrals@birthingbeautiful.org email address. We have a 24-hour emergency hotline, and we have our office phone. And then we have a program. It started at UH, but it kind of translates into other hospital systems where if any African-American woman, or sometimes any woman, comes in unattended for her birth, meaning she's by herself, they call our organization so that she is not alone. So we get a ton of referrals from the hospital systems. I mean, right now, that's probably our #1 referral source is hospitals and institutions. They recognize us, they know they know they can call on us, and we'll be there.
So I'd love to talk more about the Maternal Mortality Project. How did the project come to be with partnering to get into prisons to work with incarcerated mothers? This is such a change in mindset about mothers and giving birth in jails.
You know, this is something that we have been working on and talking about before we got it passed for about 4 years. And I will tell you, thanks to Sabrina Roberts, Dr. Megan Combs at UH, and our founder, Kristen Farmer, for really fighting on behalf of these women who are in the county jail. It's still sometimes a bit of a challenge because doulas traditionally were a little bit radical. Like people, you know, we're touchy, we're feely, we're helping these moms, and that's so not the way of the jail. And so it's been something that we've had to work on. But when I tell you, my partners on this at Moms First and UH and Metro and Moms First have been just out of this world incredible, because we're there, we're attending these labors and delivery, we're in the jail, we're providing centering, we're providing education, we're ensuring that they still get to have dignity. And I think that's my big thing, is like, it's just about making sure that women have dignity no matter where they are.
How do you plan to staff the birthing center, and will you partner with the hospitals in our area?
So we will have transfer agreements. We already have transfer agreements in place with Cleveland Clinic, and we are working on with UH. And so we will absolutely be partnering with all of the hospital systems, because again, less than 1% of women will birth at the birthing center. It's not going to be like we're doing thousands of births. We'll probably be doing 150 to 200 births per year. And so we want to work with the hospitals. We will still go to labor and delivery. Not every woman is going to even want a natural birth. That's the part of it. You have to have a natural birth to birth at a birthing center. And so we know that everyone isn't going to be there, but we have so much support from the hospitals. You can't do this. The reason that there are no other freestanding birth centers is that you have to have a collaborating physician, and you have to have that transfer agreement. And we have been able, because of the trust that the hospitals have with us, been able to already get 2 on board. And I know we'll be not far behind with the others. So that means our birthing center is actually going to be able to happen because of that trust and respect. And we will have a certified nurse midwife who will staff the center, some LPNs who will be there to start off, just one. And then hopefully we'll continue to grow as time goes on.
Do you have infant and toddler development supports for moms, specifically those moms who have children with disabilities?
So we do. We have a couple of members of our team who are social workers who are working to help with that. Those are some of the areas that we also partner with organizations like Starting Point and Help Me Grow, because we recognize we cannot do everything, but we are able to then provide them, whether it's a referral or if we can be supportive, we will be supportive. But we do want to refer to people who have the expertise in those areas.
So as you look at the work that you provide, we've talked a lot about moms and babies thus far. How do you engage fathers in the process?
I'm so glad you just asked that. You're asking really good questions. We actually just hired our first full-time male staff member, and he started last week. He is going to be the head of our Fatherhood Initiative program, because we've always worked with dads, but it's just been my doulas and my admin team working with the dads. But now we're like actually getting a father involved who's going to really help do programming. We have an event on June 25th for them fellows at League Park. Really looking forward to engaging with them and supporting them to ensure that we're building healthy and strong families.
So going back to the birthing center, will all Cleveland moms have access to this, or just clients of BBC?
All Cleveland moms, and I'm going to be honest, because we don't have a freestanding birth center, I really believe that people will travel from all over the state to have their babies here if they want a birth center birth.
So as you think about the needs of our community and the challenges you face, what is that greatest challenge, and how are you working to overcome it?
You know, it's so multifaceted, which is why we at Birthing Beautiful Communities have to provide all these wraparound services, because one thing ties into the next. And so for us, I can't say one, but I can know that we all know that poverty in our community is rampant, and it's really impacting all of us. Housing insecurity is a big issue that we're facing, and just again treating people with dignity and respect. So everything, I don't know, it's really hard for me to say, because I just look at everything as a microcosm, that you really have to address that holistic circle, and there is not a one size fits all.
Are there programs across the country like BBC? And if so, who do you look to learn from? And how do your outcomes compare to those organizations?
So there are maybe only about 6 or 7 organizations like this in the country. And I will tell you guys that Birthing Beautiful Communities with 45 staff, we are the largest doula agency like this in the United States of America, right in our own backyards. We probably have one of the largest operating budgets for a doula agency because of, again, our community and our government support and the respect and trust that we've been able to build. And so I look to those sisters as my colleagues, as my peers, and this is brand new, less than 5% of, and I talk about, so this is BBC. Now this is BBC in the Birth Center. This is a concept that's been popping up, and there are about, I know we're on a call with Black and Indigenous people of color led, less than 5%, and probably less than 1% Black owned. But my sisters in Birth Detroit are doing the same exact thing. They started as a doula agency and they're now going into a birth center. And I have a colleague in Boston who is also neighborhood birth center, who is also doula agency moving into a birth center. So this is a model that is picking up. What I have seen from the ones that have already opened, they will say, well, we set the goal to serve 100, but we serve 220 clients, which I can see happening because, I mean, our goal is to serve 400, like, so let's say for our grant with Medicaid, we're supposed to serve 400 women. Well, last year we served, I think 520. Last month, we had 46 referrals to our program. That's an extremely high amount of referrals. And if it keeps going like that, then that just really means that our numbers are going to, we could be seeing 600 clients by the end of this year.
So Jazmin, you have a range of experiences in your background. What inspired you to become involved with BBC and take on this work?
Thank you. And I can tell we're ending, and this is like a really great way to end. You know, I had no intentions of leaving my previous job. I worked at Global Cleveland. I was so incredibly happy there. I had a great boss. You know, life could not have been better for me. And when my colleagues, we were asking me to apply for Birthing Beautiful Communities, I said, absolutely not. I'm not leaving, really happy, not taking a pay cut, you know, all those things around. Long story short, how life works, I ran into a friend who was the board chair at the time, and she said they were really having trouble filling this fundraising role. And that, you know, I'm Jazmin, you're such a good fundraiser, you're already a doula, you know, Kristen, why don't you just apply? So I applied, and I remember leaving the interview and I said, dag, this is my job. Like, this is my job. And how am I going to tell my boss? Now that's the first interview. I already claimed it. I'm like, okay, how do I start to prepare my boss to let him know that I'm leaving? Because I'm going to work at Birthing Beautiful Communities, and I've been here ever since. And I love this work. I love this job. I'm inspired every day. We work with some hard stuff. We hear hard things every day. We're dealing with miscarriages, and we're dealing with women who have just not healed from traumas and generational traumas, and really getting them to shift a narrative and a mindset and a change a community and a people, right? So the work that we're doing is so, so challenging, but it is so, so rewarding when we get to see those babies at the 1-year birthday celebration. And we are at the point of hiring a volunteer coordinator. I've seen several people have asked, are there ways to volunteer? We have classes that are available for folks to volunteer. We're starting to do more events. In November, we'll host a drive for our families. There's so much and so many different ways to get involved with our organization. And in the meantime, you can email me at jlong@Birthing Beautiful Communities, but we are going to be bringing on a volunteer coordinator to support the tremendous desire we have from the community to get involved with our organization.
Jazmin, we do have time for one more question. So there have been a few questions around the advocacy piece. So what are the names of the bills that you are advocating for currently?
Okay, we are advocating for House Bill 142. That is the doula reimbursement legislation. We are also supporting House Bill 611, which is around certified professional midwives being able to practice at birth centers. But our birth center, I want to be clear, will be staffed by a certified nurse midwife.
Well, Jazmin, we have certainly covered an array of topics today, and we are so thankful for the work that you and your organization do for our community. And we are so excited to watch your progress towards the birthing centers. We know this is such a need for our community. So thank you for your time, your passion, and all of your effort. We thank you so much for being here today.